fitness education seminars. Welcome to this edition of Fitness Insider. This topic is about minimalist shoes. And what's a minimalist shoe? It's basically a shoe that's designed without a lot of extra arch support and or stability control. So a shoe like this would be an example where it's just a thin sole of the shoe, and if you took the shoe you can bend it, twist it, there's not a lot of support. The Vibram's 5-finger is another example of this type of shoe. It's the most extreme example in the sense of it only has a thin rubber coating separating your foot from the ground, and it has 5 separate compartments for each toe. So again, this allows you to mimic barefoot running and or walking. Now the question that always comes up is, are these shoes appropriate for me and or my client? And here's a question. Can you control your foot, ankle, and lower extremity while you're wearing these shoes? If the answer is yes, you have earned the right. We talk a lot about earning the right in our program, the Integrated Movement Specialist program, that you have to earn your right to wear these shoes. If you can control the arches of the foot, the 4 arches, the medial longitudinal arch, the lateral longitudinal arch, the transverse arch here, and the transverse arch across the midfoot, you have earned the right to wear these shoes. If you cannot, or your client cannot, you have not earned the right. Doesn't mean you can't use these shoes. You just have to progress your client into these shoes. And what do I mean by that? Is if your client is barefoot, have them stand on one leg and raising the other opposite leg. Now, if they can control their lower extremity, you'll see they can maintain the tripod and maintain alignment of the foot, ankle, knee, hip. So again, if I lift my leg up, there's a little bit of sway, which is normal, but it shouldn't be huge amounts of sway, and you shouldn't see the arch collapse and or leaning on the inside or the outside of the foot. It should be relatively well controlled, the tripod's maintained, and I'm able to stay long over top of my foot. You check both sides, same thing. Can they maintain the tripod, the arches of the foot, maintain alignment of the foot, ankle, knee, hip, and upper body over top of their stance leg? If they can do that, then check out a squat pattern. So you see if they can maintain a squat and maintain all the connections and all the alignment issues we just talked about. If they can do that, you may be able to take them through a walk, run progression to get them into using these shoes for running, if that's their goal, is to run in a more minimal shoe. If they cannot control it through these simple patterns, they have not earned the right to use them for any length of period. So if you want to progress them, again, if you have a client that's wearing a supportive shoe, you have to graduate them down. Don't go from a supportive shoe or an orthotic right down to a minimalist shoe. Graduate them down. Just like you wouldn't start a client that wants to run a marathon by running a marathon, you would graduate them up to running a marathon. Same thing here. If you want to go to a minimalist shoe, graduate them down to multiple levels of more minimal shoes until you get them, if you can get them to a more controlled shoe like the Vibrams. If they have foot pain, bunions, things like that, or they've been prescribed orthotics or a supportive shoe by their chiropractic physician, physical therapist, or medical doctor, then don't take it upon yourself. Do your due diligence, check in with their healthcare professionals before you change their footwear. This is Dr. Evan Osar talking about minimalist shoes. Make sure your client earns the right to wear them and help them make informed decisions about which footwear is appropriate for them, and learn as much as you can about the foot and their footwear, and you'll be a great resource for your client. Have a great day. We'll catch you next time on Fitness Insider.